Thank you, Mark. This morning, we are learning more about a form of dementia diagnosed in actor Bruce Willis. The 67-year-old has frontotemporal dementia, or FTD. Last year, you'll remember he retired from acting after revealing that he had a brain disorder called aphasia. Now, the condition affects a person's ability to communicate, as it was described before, making it difficult to write, speak, even understand others. His family says it is a relief now to finally have a clear diagnosis. Dr. Rajul Parikh is a neurologist with HCA Florida Memorial Hospital, joining us this morning via Zoom. Good morning. Thanks for being with us.
Good morning.
So initially, the diagnosis was, aphasia. Now it's FTD. Are these related?
Yes, so, there are multiple different types of dementia. Obviously, the most common that we know of is Alzheimer's, but frontotemporal dementia is one of the second most, I think, common dementia that we have. It affects the ability to communicate, as you already earlier said, like able to understand people, able to come out with the words. So aphasia is a symptom of the disease. It can happen from stroke, but it can happen from this kind of dementia also.
Is this common?
Not very common, no. This is relatively uncommon. Unfortunately, there are no treatments available for now, but it affects people's personality, their ability to function, execute different things, their ability to interact with the people.
Which is so difficult, I can imagine, for his family. Is it more prevalent in men or women and at a certain age?
So it's more common after, obviously, around 60 or 65 years of age. It's a little bit earlier onset compared to what we see with other Alzheimer's or other common dementias. But it's pretty similar. I think it's more common, somewhat more common in the women than men, but it's very similar to in both men or women. And as I said, it's kind of earlier onset compared to the regular dementias overall.
And what are warning signs for our viewers at home who may be concerned?
So it will be mostly, this is not as similar to as Alzheimer's, which presents more with the forgetfulness. This is more with ability to come out with your words, or ability to express yourself, ability to communicate, your personality changes. That's one of the common things people see at times with this kind of dementias, where you're not yourself. You're not behaving yourself the way you used to. It's just a change in personality, change in able to communicate, understand, or make decisions. Sometimes they make totally erratic decisions, and relatives say that, okay, why is he acting like this, or why is he behaving like that? So it's more of a personality, more of a language problem, or ability to express and understand yourself.
But you can see why that would impact an actor having to remember lines. Is there a treatment or any kind of medication, anything that can delay this from getting worse?
Unfortunately, not for this. Now, there are no proven treatments so far. There are different things that they do. They work with the speech therapy, try to work with the communication side of it. There are some medications just to help with some of the mood or behavioral side of the symptoms, but there are no clear proven treatments, unfortunately, so far.
So as we think about Bruce Willis in the next 10, 15 years of his life, or anyone else who is diagnosed with this, what are the kind of the long-term consequences?
So it unfortunately is a progressive condition. So it gradually gets worse. It affects more and more trouble with the speaking, talking, able to function. And it just the family has to kind of help him more and more, and he has to rely on other people to take care of obviously the daily functions and take care of other things in the day-to-day life. So it just kind of progressively gets worse overall.
Is there anything to prevent it?
Not really, no. I think what we generally suggest is obviously keep up with the good lifestyle habits. Obviously, some kind of daily exercise helps. Good diet overall, more green vegetables, more protein-based diet, and also keeping up your mind active and involving in some kind of different activities every day that helps out overall.
Dr. Rajul Parikh from Memorial Hospital joining us, neurologist. Thank you for your time this morning.
Thank you.